Young people need to take risks as part of their development, but there's a big difference in helping them take positive risks rather than negative risks. And I think that's part of our role is helping, encourage them in pursuits like go out for student council or try some, new sport activity or try a musical instrument. Take some positive risks that allow them to develop their independence, but keep them safe from the very obvious harms of sexual activity.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts who can provide insights to support you in your life-affirming practice and career. I'm Miriam Diallo, APLOG's Communications Manager, and I'm excited to share with you a conversation with Lori Kuykendall, President of Beacon Health Education Resources, which is an organization that provides training, consulting, speaking, and advocacy in the field of health education and specifically sexual health education. Lori has a Master's of Public Health and Health Promotion from Liberty University, and she has worked for around 3 decades in this field of health education, including at pregnancy resource centers and in leadership at organizations such as the Medical Institute for Sexual Health. Today, she is going to be talking to me about a topic that is fairly foundational to the work that she does, and that is sexual integrity. And I'm hoping that the insights she provides in this area will help you as you counsel patients and educate them on how to be holistically healthy. Let's jump right in. Lori, it's an honor to have you on. Thank you so much for joining.
Thank you for having me. I've looked forward to our visit.
Absolutely. Now, just to get our audience started, why don't you start by telling us a little bit about yourself and how you got started working in health education and at Beacon specifically?
Sure. So, from the time I was a little girl, I wanted to be a pediatrician. I was in a small town. We had a small pediatric practice that had 4 men and 1 woman doctor. And I was with Dr. Mike for a long time. And then when I got to go to the female doctor as growing through puberty, that was a gift to me. And I thought, what a neat thing that she's been able to do for me as a young girl growing, and wanted to be a female pediatrician. So headed off to school, to college in Texas, thought I would be in pre-med, and took a health education class. And about the same time I was being introduced to the field of health education, I was realizing how long it was going to take me to become a female pediatrician. And bless all of you who have done that hard work. But for me, it was like, oh dear. But at the same time, as I said, introduced to the field of health education. Now, this was in the mid 90s, and health education really was emerging as an important part of the healthcare system. That we were figuring out we could save a lot of money and a lot of lives and a lot of quality of life if we could do more on the prevention side, work more upstream, and work in education. And so many of the major causes of morbidity and mortality are preventable, 100% preventable. So that kind of drew me into taking my love of medicine and interest in healthcare on over to the prevention side. So completed my undergraduate work in community health education, and then would later earn my master's in public health, in health promotion. So happy to put all that to work, what's now been 30 years. A lot of that has been in the space of sex education, starting out in pregnancy prevention, teen pregnancy prevention, through the pregnancy help movement. My first job out of school was at a pregnancy help center. So it's been fun to kind of tie together health education into that space specifically and be a part of the changing culture and the changing challenges that have come along since then. I always like to throw in my personal pieces as well, as you asked to tell me a little bit about myself. I've been married to my husband, Chris, for 31 years, which sounds like a lot, but has been a blast and not seemed that long at all. And we have 4 young adult children, 3 girls and a boy. Really should call them 3 young women and a young man who are in their 20s, and they are my joy.
Congratulations. And I think your career journey really highlights a really important insight, which is at AppLog, at least specifically our CEO likes to say that life affirming medical professionals are frontline workers in a sense of this battle of serving women who are pregnant under really tough circumstances. They're the ones that pull up a chair and sit down with them and talk them through their options and try and offer life affirming care and counseling as best as possible. But as you said, there really is a lot of prevention work on the back end that can be done that is arguably even more important in the sense that it comes prior to laying that groundwork for women to have a healthy understanding of themselves and in such a way that reflects in the relationship decisions that they make. So thank you so much for the work that you do. And I think this segues well into the topic for today, which is sexual integrity, one of the things that Beacon talks about. Could you tell us a little bit more about what sexual integrity is?
So there are lots of words in this space: chastity, purity, abstinence. We all use different wording. The reason I like to use sexual integrity is because it speaks to wholeness. If you think about that word integrity, it's like we learn about integers in math. Those are whole numbers, right? So it speaks to this idea of wholeness. And I think about wholeness in terms of completeness and health and thriving and flourishing and all those good things that come along in a positive light. But then it also speaks to wholeness around 5 elements of health, which are physical, intellectual, emotional, social, and spiritual health. So, those 5 aspects of what we call optimal health are part of that wholeness. And when we're speaking about sexual integrity, we want everyone, young people especially, to enjoy thriving and whole health physically, intellectually, emotionally, socially, and spiritually.
Absolutely. That's obviously something a lot of people would resonate with, that physical health is only one piece of the
Yeah.
puzzle, even when you're talking about reproductive health. How does this concept differ? So I know both sides, I would say, like to say that they support holistic health, but there's that concept of comprehensive sex education, right? Also evokes that imagery of being holistic. But I imagine you would have some differing thoughts on what it means to offer holistic education, health education. So, how does this concept of sexual integrity differ from some of the dominant theories that currently undergird contemporary sex education?
Well, that's a big question, a hot topic question in the debate
I
over
imagine.
sex education in the culture today. So there's really 2 opposing, very much so contrasting approaches to sex education. You've mentioned comprehensive sex education, and the assumptions under comprehensive sex ed are that all of us are sexual from birth, and you'll hear their language about sexual rights, that each of us is endowed with sexual rights and should be given freedom to express ourselves for sexual expression, sexual pleasure, and the idea of that being a right for every person of all age. So this changes how we view young people. It changes how we view development. The assumption that sexual freedom is a right, and that young people should be free to express themselves in whatever way they so choose, really puts a sense of autonomy on them and minimizes their risks. But also in that approach is kind of simplifying and negating those risks. And so they kind of, the way I say, their message kind of boils down to condoms and consent, that if you've got contraception and you've got consent, then all sexual activity is good to go and is a responsible, healthy decision. You and I both know of those great risks that are physical and intellectual and emotional, and social and spiritual. Those holistic risks are real, that there is no safe sex for young people. So when those 2 approaches have their fundamental foundation, that's kind of redundant, a fundamental foundation, which both have their foundation and then their end game very different. I think it's important that we highlight that contrast. Sexual risk avoidance is what we're calling the holistic sexual integrity approach in a public policy or curriculum space. And that really takes this idea that we can promote and should promote what's really the best for young people to protect their current and their future health. So we're going to advocate for sexual integrity, which is this idea of preserving all sexual activity for a healthy covenant marriage. That in that relationship where two people are truly free to express their sexuality in a place that is safe and whole and be free from so many of the risks.
Absolutely. So it sounds like you would say that the sexual risk reduction or the alternative uh, contemporary model of sex education isn't really that holistic at all in the sense of it really just focuses on condoms and consent uh, at the end of the day. What would you say are some of the outcomes of that kind of model in terms of the negative outcomes that you'd like to avoid with the sexual risk avoidance model?
Well, certainly some of the outcomes we can start with are their health outcomes. That we know that that young people, there is no safe sex, right? Even though people will still say, let's teach safe sex to kids. Even with condoms, there's so much misinformation about condoms and a misunderstanding about what's really accurate about their level or low level of risk reduction with young people. Condoms make an assumption that young people will use them correctly and consistently. And young people have developing brains. Their prefrontal cortex is not all the way developed for them to execute high level decision making, preventive, logical behaviors. And so you think about a young person experimenting with sexual activity, the likelihood of them using all correct, and actually the CDC will show up to 12 steps for using a condom properly. So we've made it say, well, just use condoms. Let's put condoms in schools. Let's put them in the vending machines and give them out for free. So minimizes the health information, discredits and dismisses the health information around condoms. But even if we could get kids to use condoms correctly, and certainly we would want to give an accurate presentation of risk reduction, the highest of which is for HIV and followed by other fluid based STDs. The least amount of protection is from skin based diseases like HPV, which is the most common STD there is, and herpes and syphilis. Sadly, the CDC will say condoms will not provide against those three: herpes, HPV, and syphilis. And the fastest increasing STD today is congenital syphilis, syphilis among newborn babies. So I do a lot of educating and informing policymakers and parents and decision makers on these topics because so many just don't know. And yet they all start with this assumption as well that all kids are going to have sex, that they're going to have sex. It's a natural, normal part of adolescent development. And we just don't agree with that. It is not appropriate for their development. And given good guidance and support, we know most young people will not have sex. In fact, sexual activity rates have continued to fall the last 20 or 30 years. And most young teenagers, most adolescents are not having sex. They're not sexually active, according to the largest survey of high school students in America. So, so I like to kind of put all that together and say, no, they can wait, they will wait. Let's help them wait and get them that information, but not just the information, because we know information doesn't change behavior. But they truly need the guidance and most importantly, the support of parents and teachers and peers who support them in the same decisions. That was kind of a long answer to outcomes, and we only talked about STDs, but let's
Right.
go from there anyway, right?
Right, right, absolutely, and I'm sure it has wide-ranging implications, as you mentioned, but even across generations, this is something that affects newborns as well. And yeah, well, it seems like what you're saying of that foundational assumption of, well, kids are going to have sex anyways, kind of leads into the point that you were making previously, that condoms and consent is really a narrow way to look at it. Because
Right.
if you cut off that uh, uh, tool, I guess a wide variety of tools to allow children to uh, have healthy relationships in a way that they can avoid uh, having sex too soon or in an unsafe way, then really you cut off a variety of potential good outcomes related to having more holistic education. So I think that makes total sense. Those concepts do connect very well to each other. And so by contrast to some of the poorer outcomes of having a more singular physical health, let's teach how to use contraceptives in order to avoid STDs and pregnancy. In contrast to that kind of more narrow approach, what are some of the health outcomes associated with understanding sexual integrity of the more holistic approach?
Well, I think it kind of goes back to this idea of it's not just physical that we're trying to protect, that it's also their mental health, emotional health, relational health, and spiritual health as well. So when a young person avoids the risks of sexual activity, they gain all kinds of freedom from having to worry about those things, but freedom to enjoy, develop positive character, enjoy healthy relationships, freedom to pursue their academic interests and focus on their other positive risk taking activities. Young people need to take risks as part of their development, but there's a big difference in helping them take positive risks rather than negative risks. And I think that's part of our role is helping, encourage them in pursuits like go out for student council or try some, new sport activity or try a musical instrument. Take some positive risks that allow them to develop their independence, but keep them safe from the very obvious harms of sexual activity. And I was thinking actually also, this is the approach that we take with smoking and drugs and alcohol, right? I mean, it's a clear risk avoidance message. We
Hmm.
don't teach them how to have, safer drug use and safer smoking. So I don't know why we've had such a hard time. I think because it is so personal and some, and it's personal, it's political, it's moral, it's religious. Sexuality is a complex subject for sure, but I think we can certainly land ourselves on the medicine and the health that would say avoidance is best until marriage.
Absolutely. And I love that concept of positive risk taking that, yeah, I think really ties in well to the more holistic model of presenting alternatives, like ways, more productive ways to take risks and also express oneself. Because I know a big talking point on the other side is, well, kids need to be able to express themselves. Well, I'm guessing you'd say there are other ways to express oneself that are more constructive. And so, could you tell us a little bit more about some of the productive risk-taking activities that you encourage kids to engage in?
Well, sure. I mentioned things like running for student council or sports or musical instruments, but it's this idea that you are finding what you are uniquely made to enjoy and how you are uniquely made to contribute. Maslow's hierarchy of needs would tell us that the highest sense of need and fulfillment that we have is to know our purpose and our contribution. Why am I here and why does it matter? And really, that identity piece is what's truly under assault in our culture today. I think it's the root of so much of the gender confusion we're seeing is young people don't know how to answer those questions of who am I and why am I here. So when we engage them in positive risk taking, we're helping them find out what they're good at, what they enjoy, how they can help. We know that contributing and serving others actually produces this whole sense of fulfillment and confidence that allows a young person to know their place here. Sometimes we tell kids, you can be anything you want to be. I like to say instead, you can be exactly who you were made to be. and give them this idea of purpose and design and how they were made uniquely. There's not another one of them here on the entire planet. And so that's what positive risk taking does, is it allows them to explore their interests and their abilities and how they can make a difference in our world.
Absolutely. That's really important. And I think it's really helpful for our medical audience to know as well just what's going on behind the scenes from a more prevention health education perspective before their patients come in with any kind of crisis related to pregnancy. But for medical professionals who are engaging directly with their patients about health education, who are educating their community on sexual integrity, what are some tips that you might have for how to do that, how to educate their community on sexual integrity, whether in a pregnancy resource center setting or at their clinic or maybe in the schools?
Well, medical professionals are significant, major contributors in education, so much more than I think they sometimes realize. That when we can get focused so clinically on the treatment side, we may miss the power that your words have on the prevention side as well. There really is power in the white coat, right? That a doctor speaks with authority and credibility instantly, that tune the ears and the hearts also of a young person who is struggling and with some of these decisions, or is hearing some of the lies and misinformation, and when their doctor says it, whoa, now they're listening. They're saying, this culture, they call them the fact checker culture. Anything I say in a classroom, the students are jumping on their phones to make sure what I'm saying is true. A doctor comes in with that assumption that what you're saying is true. So even in a few sentences in your clinical setting, you can make a big difference. And there are questions around their character and their relationships and their cluster of risks that kind of go together when you're talking about drugs and alcohol. Throw in the conversation as well. I shouldn't say throw it in, I should say purposefully include the topic of sexual integrity, and not be afraid of promoting sexual risk avoidance from a health perspective for that young person, while you're also being open to questions and setting up that ongoing relationship with them. You mentioned pregnancy centers, a major place for this idea of sexual integrity across the range of services that a pregnancy center offers. So I was hired in 1995 by a pregnancy center to reach the girls before they need us, was the quote that has kind of been a mantra since then. And many pregnancy centers are engaged in community health education. They're out in schools in their community on the prevention and education side. There's also a place to include sexual integrity in the counseling of the clients, in the STD testing side, and also in the parenting and education classes. So physicians that are involved with pregnancy centers can watch for those different places to make sure we are addressing relationships and sexual integrity. Sometimes we can be afraid of offending a client when we really just want to save the baby and provide for the baby, and yet a really important idea for the safety and health of the baby is to help ensure that the mother is in a healthy and safety environment relationally as well. So we can talk about relationships and sexual integrity in that pregnancy help space as well. One other place I thought about, I knew a doctor years ago who spent many years going into his high school science classes to teach on STDs. They would invite him in, and he again came in his white coat with his expertise on these topics, and had slides that go along with this content, which actually is something I can provide doctors with if anybody needs this kind of presentation. I have it available through my resources, but again, being able to get out with the education message with the credibility of a physician is really strong. And I think I would be careful, because sometimes our culture dismisses this idea as it's not the medical model. That it's a religious idea, or it's an ideology. It's not. It is clearly something we can stand on. Sexual integrity is about health. and is should absolutely be the medical model.
Absolutely. And I think you bring up a really good point that medical professionals, even as trust in other professions kind of lowers, medical professionals remain a highly trusted group. And so that's a piece of encouragement there for our medical professionals who are listening, that the youth need you in the sense that you have your expertise. They still continue to look up to you as a trustworthy source of information. And so that that might be a sign that that might be an important place for you to be, is educating children in the schools and in whatever other settings you can. That's yeah, it's a really important piece of information, because that's what the polls have shown, is that uh, medical professionals remain trusted even as K through 12 teachers and journalists. Trust in those professions goes down. It remains high for people like doctors and nurses. So, is there anything else, Lori, that you'd want to say to medical professionals, by way of encouragement?
Well, I was thinking about a friend of mine who tells a story about her daughter. She's does similar work as I do and has for many years, but she tells a story about her daughter. They were teaching wait until marriage at home. They were teaching at her church as well. But then when she took her daughter in for her checkup, her annual physical that year, the doctor said, "Would you like me to put you on birth control pills?" And in an instant, almost all of that message was put under question because that doctor had a different approach and made this assumption that this young girl needed to be on birth control pills. And I think that, like so many young people are impressionable and they can learn. I would encourage, especially your strong physicians and pro-life physicians, to make this a part of their easy communication with their patients as well.
Absolutely. Yeah. What you say matters to your patients. Every point of contact matters, especially the younger they are. It really shapes their impression of what their health is supposed to look like. One last question, Lori. Where can people go to find out more about your work and Beacon's resources? I know you have many.
Sure. So my website is beaconhealthed.com. So you'll see my resources there. I've got a one pager on there that contrasts the two approaches to sex education, which is helpful when you're working in a school environment or even a health environment where you're needing to draw, objectively contrast the two approaches to sex education. And then there's also a whole section in there for pregnancy help centers and the kind of resources and training I provide through pregnancy help centers as well.
Well, I'll be sure to have those links in the show notes so that people can easily access those. Thank you so
Excellent.
much, Lori, for joining us today. Your insights have been invaluable.
Thank you. Have a great day.
You as well.